Those calling Austin and Albert Lea home are trying to figure out what comes next after Mayo Express Care Clinics in both towns prepare to shut down at the end of the month. ABC 6 News reporter Chandler Jackson has been checking in with people who live in Austin and Albert Lea today. He joins us now with more. Chandler, how are they feeling about it?
Well, Maisie, it seems across the board there's a sense of disappointment in Mayo's decision. They say that rural health care, like in communities like this, is already hard to come by, and removing these ones is just a bad idea.
And that is one of the things we like, is the ease of, sometimes being able to get in quicker.
Gina Grunmeyer is one of many in the Austin community concerned about the change coming to their local Hy-Vee grocery store. The closure of the Mayo Express Care Clinic housed within. So concerned, she started a petition to keep the clinics around. In the days since Mayo's announcement, that petition has garnered just over 500 signatures. Down the highway in Albert Lea, it's the same story. But Brad Ahrens, president of the Albert Lea Healthcare Coalition, thinks it's time for communities like Austin and Albert Lea to come up with their own healthcare options.
I mean, we have employers that are forming their own clinics, primary care clinics. Why? Because you don't want to drive 60 miles for those type of visits.
Luckily, Austin and Albert Lea aren't completely without options. All Thing Clinic, headquartered in Austin, is already looking to fill in the void that will be left by Mayo, with extended same-day care hours and a new site in Albert Lea in the future.
It was an opportunity for us to remind people that there is a community clinic committed to these communities, embedded right into the community, waiting for them, and excited to see them as patients.
I think people want to see value in themselves again, and not just that they're a number, patient ID number. They want to be seen, I think, people as individuals, and that personal care, even if it's an express clinic, they still feel that there's a level of personal care in that.
Now, these express clinics are currently scheduled to close after July 27th. And Maisie, I understand that we just a few moments ago got a response from Mayo about these closures and the concerns of the residents in these towns.
Yeah, that's right, Chandler. Take a look. Mayo Clinic telling us in part, quote, staff from Express Care will transition to roles at our Austin and Albert Lea clinics, helping to increase appointment slots for patients and maintain continuity. By offering this care at the main clinics, patients will also benefit from integrated access to lab, radiology, and other support services. And you can read that full statement on our website right now at KAAL-TV.com.